Hi, everybody, and welcome to episode 21 of the Pet Behavior Chat. So, today I wanted to talk a little bit about the difference between supplements. So, we often hear about calming supplements or anti anxiety supplements, and then medication. So, what is the difference between those? And I want to kind of touch on 5 different areas. And this is actually a topic that somebody requested. Somebody wrote into us and said, they get so confused by the availability of all the different things that are out there. And in fact, there are such a host of different supplements on the markets. How do you know what to choose? Is it the same as behavior medication? And it's all just a bit of a confusing topic. So I just wanted to shed a little bit of light on that. And I'm going to, as I say, break it down into 5 areas. So the first area that I think we need to consider is that supplements, also known as nutraceuticals, sometimes known as over-the-counter supplements, are exactly that. They can be bought without a prescription. They can be bought essentially over the counter from either an online veterinary pharmacy or an online shop. There are lots of different places that you can buy calming supplements and nutraceuticals from. And you don't need to do that under the guidance of a veterinarian. You can just go ahead, buy them, read the label on the package, and go for it. Now, medications, we call them psychopharmaceutical or psychotropic or psychoactive medications. They're often referred to also as behavior medications. They are really only able to be prescribed by a veterinarian. So there might be other industry professionals such as behaviorists or trainers that are not vets that might know a lot about them and that might be able to sort of recommend them. I know that many do. However, they cannot prescribe them. You cannot get them through these professionals. And even though they can maybe make a recommendation, they probably don't have the level of training and the level of knowledge that we as vets have. So that whole kind of pharmacology background, how medications interact with the patient's body, all those things are really kind of within the veterinary realm. As I said, many of the professionals have quite a good knowledge about them. That's perhaps because they've had maybe their own pets have taken medications, or because they've recommended them to clients, or because clients' pets have used them and they've seen how effective they can be, and they may be able to recommend them, but they definitely cannot prescribe them. So that's a really, really important difference. And I think in that same vein, as well as being able to prescribe them, veterinarians also really need to continue to monitor your pet, to recommend, annual or 6-monthly blood checkups. They need to be able to advise you about side effects, which I'll talk a little bit more about in a second. But it's not just the prescription, it's the ongoing monitoring and guidance as well. So it's really something that needs to be quite strictly overseen by a veterinarian. So all of my patients that are on medications, certainly in the first few weeks that we start them on the medication, we send a WhatsApp check-in every 2 days, every 48 hours, to ask them how they're doing, how their pets are doing, whether they're having any trouble administering medication, whether they are seeing any unwanted side effects. There's quite a lot that we need to monitor and be aware of. So that really frequent communication and that kind of strict monitoring and checking in with clients, letting the clients also feel that they're not alone, especially when they first start medications, that's a really important piece. So that's the first difference between supplements or nutraceuticals that you can get over the counter versus prescription medication. The second thing I want to talk a little bit about is the regulation. So supplements and nutraceuticals essentially aren't regulated. So there is no governing body. There's no body that looks at, whether what is actually said on the packet is actually what is in the supplements. There's no level of sort of governance or surveillance of the supplements and the nutraceuticals. And it can be really quite shocking and surprising when you actually look into what's in the supplements and nutraceuticals versus the claims that they make on the package. Those are often quite different. Now, alternatively, the medication or the prescription medications are very strictly regulated. So they are strictly regulated by whichever governing body that is in the country that you're practicing in. So in the US, for example, that would be the FDA. So we have strict regulating bodies, and we make sure that medications have undergone rigorous testing, rigorous research. They need to really be able to show that what they claim is in the medication is actually in them. We look at a lot of different kind of ways that the medications pass through the system, to pass through the body, how they're excreted, how they're metabolized, all that kind of thing. And that makes them in many ways probably safer to some degree, but certainly more regulated. And we're actually very lucky that we have quite a large number of psychopharmaceutical medications that have been licensed for veterinary use. Maybe not for every species and maybe not for every indication, but we do have veterinary licensed psychopharmaceutical or psychoactive medication, which is amazing because it means that, there's been extensive research in that species for that particular presentation or diagnosis. And we have some good evidence base to be able to prescribe these medications. So I'm just going to let you know which ones they are. So there are 7 to my mind. I've probably forgotten maybe 1 or 2, but the most common ones. So we have fluoxetine, which is Reconcile. That's the veterinary formulation, which is licensed for dogs for separation anxiety. Then we have clomipramine, which we know as either Clomicalm or Clomav, which is also licensed for dogs for separation anxiety. Then we have selegiline, which is Celgene, which is a popular European medication, which I believe is licensed for generalized anxiety and cognitive dysfunction. I might not be 100% correct on that. Then we have a compound called imepitoin, which is Pexion, which is licensed for dogs for noise phobias. Similarly, we have Cilio, which is the oral dexmedetomidine gel, or oromucosal dexmedetomidine gel, which is also licensed for dogs for noise phobias. And then we have a couple of new ones on the market, which is tasipimidine and pregabalin. And they are 2 compounds that are not widely used yet. The pregabalin is a very interesting one. It's a gel formulation for cats, which is intended to be like a pre-veterinary visit medication, similar to how we use gabapentin, but not as a capsule, as a gel, which makes it more easy to apply. So it's an oral gel. And those are 2 to watch for sure. I think they're currently licensed in Europe. I want to say in Sweden, maybe a couple of other countries, but they should hopefully be coming to the rest of the world soon. So I think that's a really important piece, is that we have actually quite a large number of veterinary specific medications that are, licensed for veterinary use. Yes, the species are restricted, and yes, the indications are restricted, but it's much easier to kind of use those medications for other species and other presentations because we have quite a bunch of evidence on the species and indications that they are licensed for. Now, obviously, we do use a number of medications that are not licensed for veterinary use, also for our pets. So I'm thinking of other SSRIs, that's selective serotonin reuptake inhibitors, other tricyclic antidepressants. Amitriptyline has been, a medication that's been used quite a lot in the past as well. We use also things like clonidine, trazodone, gabapentin that aren't licensed for veterinary use, and we do have to use the human formulations of those. But I think that regulation aspect, when we're looking at supplements and nutraceuticals versus actual medications, there's quite a big difference there in the way that they're regulated and how sure we can be that they're actually going to be useful, that they're actually going to work, that they're actually going to say they do what they claim they do. So yeah, we do have some supplements and nutraceuticals. I'm thinking in particular about Zilkine and perhaps Angzitane and a few others where we do have extensive research that probably make a little bit more sense to use from a supplement point of view. But then we have so many others on the market that are calming supplements that contain, herbal compounds and flower compounds that we don't have a great amount of evidence base for. So that's the second point, the regulation piece. Now, the third thing I want to talk about is efficacy. That means how well do they actually work? Are they actually going to do what we're hoping that they're going to do? And I see a big difference here in supplements versus medications. And I always look at it a little bit like we need to try and understand how severe is the animal's behavioral presentation. How high are their levels of fear, anxiety, stress, frustration, arousal, impulsivity, whatever it is that we might be wanting to treat. And do we think that a supplement is going to be able to combat that level of presentation? So perhaps if we have maybe a very mild case of stress where the animal's showing mild signs of anxiety or stress, or we're perhaps dealing with maybe a short-term event such as moving house, or maybe air travel, or maybe relocation from, like I say, one house to another, or maybe a short-term boarding or kennel stay, cattery stay. Perhaps those types of situations lend themselves more to thinking about supplements. However, I've also seen pets that have been extremely distressed in those situations, maybe during a cattery or a kennel stay, or air travel can be very, very stressful for some individuals. So we always need to look at the individual animal, the level of behavioral presentation, and the context that we want to be using these either medications or supplements in. And then we need to make our choice. We need to think about, is a supplement going to do enough for us? Is it going to be effective for that patient? Or do we need to consider something that we're perhaps more confident is going to have that effect, that level of effect in that individual animal? And when we talk about supplements, so I do use Zilkine quite a lot. I have used Angstine quite a bit in the past, which is L-theanine is the active ingredient in that. And Zilkine, we have alpha-casozepine as the active ingredient. And I would say they can be effective, mildly effective, or even moderately effective, but probably only in about 70 to 80% of my patients. So I already know that when I'm reaching for a supplement, it might not work in maybe 2 to 3 out of 10 of my patients. So again, it depends on, how bad do I think the behavioral presentation is, or how severe do I think the behavioral presentation is, and what am I going to reach for in that situation? Now, also, medications aren't going to be effective for every patient, but I think we've got a slightly higher chance of finding a medication that's going to be effective. So that's efficacy. Now, the other thing I wanted to talk about is side effects. And side effects, and then my final point is interaction with other medications and physical health. And this is a little bit more of a gray area, because I do believe that some of the supplements can have side effects, and they can have interactions with other medications that the pet might be taking, especially where we're using herbal compounds. Herbal compounds absolutely can interact with other medications and can interact with other health presentations. However, in my experience, side effects are less of a problem and are something that I see far, far less when we're talking about supplements and nutraceuticals. They're often more natural compounds than perhaps when we are using psychotropic medications. And I touched on it in my first point, is that sort of monitoring by a veterinarian when we are thinking about medications. That's something that I'm a lot more strict about, and I'm a lot more considerate of. And we make sure that when we do start a patient on psychotropic medication, that we 100% are monitoring them, and that we're having those frequent check-ins because of side effects. And that's something that I perhaps don't worry as much about when I'm recommending a supplement or a nutraceutical. And sometimes, it also is very much client dependent. So some clients might be really, really worried about side effects. Some clients might be really concerned, and it might kind of push them into one direction. They might lean away from psychotropic medication and lean more towards perhaps using a natural supplement first because of, that lesser risk of side effects. And again, then you want to be looking at kind of weighing up the behavioral presentation. And, there are some cases where perhaps that patient is in such a poor state of mental and emotional health and has such severe behavioral presentations where I do advise, even if the client is a little bit medication adverse, that we're probably not going to achieve the outcome that they want to achieve and improve that pet's welfare and behavioral health without the use of medication. So side effects is something definitely to consider. We obviously, do no harm is our first mandate. We obviously don't want to be putting a pet into a situation where they're experiencing side effects that we don't want or we don't like. But those side effects also can be transient and may well, and in most cases do pass after the first week or two of medicating the patient. Most common side effects for medications are reduced appetite and lethargy. That's what we see most commonly. So animals can be a little bit dull or a bit sleepy for a few weeks, and their appetite can reduce as well for a few weeks. But we usually manage to get them eating something. It might not be their usual diet, but we can usually get them to eat some chicken or some meat or something they absolutely love, something higher value. So those are the two most common side effects we see. There are some others which we see rarely, but again, that's why it's so important to be monitoring these patients so that we can intervene, we can stop the medication, or we can, reduce the dose, or we can change something. So that was a little bit about side effects. And then my final piece is interaction of either medication and or supplements with other medications or other things that the pet might be taking, and perhaps other health presentations. So for example, if I have a patient that maybe is also an epileptic patient that has seizures or that maybe has a known heart condition, I might be choosing a different medication, or I might be staying away from medications and maybe using supplements instead. So that's something that we absolutely want to consider. Some of the medications, some of the SSRIs can interfere with blood clotting. So, we want to know if that patient is perhaps on a non-steroidal anti-inflammatory, and we want to be making our medication choices really wisely and really carefully, especially if the pet is taking other medications for other chronic conditions, such as chronic pain, for example, or if they suffer from other health conditions. And seizures and heart conditions are probably the two things that we look out for most in that scenario. And again, that's something that we perhaps don't need to be quite so stringent about when we're thinking about supplements or nutraceuticals. The risk of interacting with other medications that the pet might be taking, or the risk of them affecting other health conditions that patient might have, are perhaps a little bit less. However, I just want to really stress here, depending on what kind of supplement you use and what kind of nutraceutical you want to use, especially if they're herbal or they're plant-based, you can absolutely still get interactions with other medications or other things going on in that patient's body and physical health system. So yeah, it's a bit of a gray area. You can't say definitely, yep, with meds, we need to be really careful, and with supplements, we can forget about all that. No, that's not quite the case. However, there's probably a slightly higher risk when we're using psychotropic medications or psychopharmaceuticals for interactions and side effects and risks in terms of other comorbidities in that situation. So that's a little bit of an overview. I hope that's made it a little bit clearer. I think there is a place for both. I think there is a place for over-the-counter supplements and nutraceuticals, and there's absolutely also a place for psychotropic medications. But deciding what to use for your pet or your patient, if you're a vet listening or a veterinary nurse listening, deciding what to use needs quite a bit of consideration. And sometimes the medication choices that we make, need to be thought about really carefully. And there are other things that we need to consider as well, such as how many times a day does that pet take that medication? Is that going to be a stress factor if they need to take medications 2 or 3 times a day as opposed to once? And the list goes on. There are so many more things to consider, and I will most definitely do another episode on that when we start to kind of talk a little bit more about the psychopharmaceutical medications. But that was a bit of a start. So the difference between supplements and medication, I hope that's given you a little bit of an overview. And yeah, I hope that helps you make your choices wisely when considering what to use for your pet or your patient. All right. Thank you so much for tuning into this episode, and I'm looking forward to seeing you again in episode 22. Bye for now.